Hello.
Hi, Supreet.
How are you? I was in the
Good,
wrong meeting.
thanks. How are you?
Good. I was in the wrong
Great.
meeting the whole time. Yeah. Okay.
Sorry, I couldn't hear.
No, you're good. You're good.
Okay. Hi, ladies. I'm so glad you all are joining in today. Hello, hello. Welcome, all of you. We'll just give it a few more minutes for some more of you to join. Happy Saturday to everyone. Hope everyone is doing good. So my plan is basically I have a slides and presentation. So I would like to use that to kind of go through the talk today. And then at the end of it, we'll have a question answer round. So I hope that works for all of you. And of course, you know, we are in a group setting, so I cannot give like personal one-on-one medical advice, but I can answer general questions. So I'm happy to do that. So far I see Ellen, Dawn, Linda, Michelle, Lisa. Welcome, ladies. I hope you and your family, everyone has been well during this time. Okay, I'm gonna go ahead and share my screen here. Okay, let's see. Oops, sorry, I don't mean to move that. Let's do this. Okay. I'm so glad that you've taken the time on Saturday to join me. I see we have more people joining in. Okay, so let's begin, ladies. Thank you for joining me again on Saturday. And today we are going to talk about understanding your thyroid. So let's begin. So why is it important, right? Why are so many of you interested in learning more about this? Just because this condition has become so common. The statistics show that 60% of people with thyroid disease are actually unaware about it. And women are definitely 5 to 8 times more likely to have thyroid problems. So that's why we all are here. And why is it important to correct the thyroid if you have a problem? Because it puts one into like conditions of, you know, cardiovascular risk, osteoporosis, infertility. So we are trying to prevent the risk of getting any chronic diseases. And these are some numbers about statistics in the United States. And a large number of patients with hypothyroidism have developed it because of an underlying autoimmune condition, which is called Hashimoto's thyroiditis. And when I see patients in my office, most of them don't even know that they have this present. So we are going to learn more about that. So why do I want to help people? Because I've been in your shoes. I've had personal history of thyroid problems that were undiagnosed for a couple decades of my life, actually, growing up. I always had the problem, which I didn't know till I was actually diagnosed. I share my personal story in my book, and I want to help women feel like themselves physically, mentally, and emotionally. I say that because thyroid affects you as a whole person. It's just not enough to put you on a medication and say bye. No, it doesn't work like that. So what are the symptoms? Let me say that when one's thyroid is under functioning or hypothyroidism, that is what we are going to focus on a little bit today, because there are different ways. There's hyperthyroidism, hypothyroidism, then there is Hashimoto's thyroiditis, there is Graves' disease. All of these are conditions related to your thyroid. So basically, thyroid is our gland located in the neck, and it takes care of our metabolism, and that's why our energy production. So imagine if the thyroid is slow, everything is slow in your body. When things slow down, you will, gain weight. You'll have difficulty losing weight. You will be tired, not only physically, but even emotionally, which can be seen as depression. You may be losing your hair, dry skin, nails. Patients with hypothyroidism have anxiety or depressed moods. Since everything is slowed down, there is not enough blood circulation going on. There can be fogginess in the brain. And one is more prone to infertility because the menstrual cycles are irregular, because things are not happening regularly, so the ovulation is disturbed. So there is a thyroid screening questionnaire. I actually sent out an email 15 minutes before. You should have received it since you are here. And if you click that link, you will be able to view this page and see if you have any symptoms that are concerning to you. And maybe some of you are probably already on a thyroid medication, and that's why you're interested in learning more. But I say, if you have checked more than 5 boxes here, then you may want to reach out for help. So this is my book, 7 Steps to Heal Your Thyroid, which was published in November of 2018. And today we are going to focus on step number 1, which is understanding your thyroid. So just to show you, the 7 steps are understanding your thyroid, which we are going to talk about today. And then I want to continue this series, every weekend. And we'll be sending out emails about it and even on social media. So if you're interested, you can join to understand the complete picture. We'll be talking about different treatments, the foods that help the thyroid, what supplements, how much, etc. in the following weeks, why the gut health is important, why the liver plays such an important role in detoxification and how it processes your hormones, why it is important to see the whole hormone pyramid at the same time, not just focusing on the thyroid. Step number 6, emotional healing plays a huge role. And I'll be sharing a little bit of my story with that, and the whole picture, mind, body, and soul. So that's just a summary of my 7 steps, but each step is extremely important, and we will be talking about that in the following weeks. So today, what are we going to focus on? So what are the signs and symptoms, which I just briefly mentioned to you? And then I want to go over some of the lab results. I'm going to show them to you. I want to show you what are normal thyroid results compared to what are optimal. Because a lot of times when I see patients, they have been told by their doctors that everything is fine, your thyroid is fine, but then they come to me crying for help, that no, it is not in my head, I'm really suffering. And then this important part, what is the root cause for you? We will touch upon that briefly, and I'm going to leave you by thinking about that as well. So this was me on Sonoran Living. I believe this was last year with one of my patients. And I was talking about the hormone pyramid that time. I think that's why Terry has the triangle. She's showing the triangle there. And this was on ABC 15. Again, I was talking about the thyroid. That's why my hand is where the thyroid gland is located. And then this is me. You know, this is me years ago in high school, actually. A lot, when I show this picture to my friends or family, they don't really believe, really, is that you? I didn't recognize you. Yes, I was struggling, and nobody thought about testing my thyroid. And that's why, you know, after my thyroid was corrected, it was a night and day difference for me. And I've been like working on finding the cause and what's important and what not. You know, I keep researching, and that's why I want to share this with all of you, because I never had regular cycles. My forehead was always broken with acne. That's why I have all this bangs over there. I was always losing hair. You may see the dry hair with a small ponytail in the back. I was always tired. I couldn't wake up in the morning. I was always, you know, like late to school and etc. So I can go on about my story, but I'm here to tell you more. But I want you to know that if you are experiencing this, I have been in your shoes, having mood swings, bursts of anger, you know, things like that. So I have been in your shoes. And I don't want you to suffer, and that's why it's my passion to help women feel their best selves. So I moved to the US in 2003 with the dream of becoming a naturopathic doctor. I'm born and raised in India, Mumbai, come from a big city there. And I studied homeopathic medicine actually as my undergraduate. And there were students from the US that were rotating, you know, at our clinic and hospitals who had come down for a period of time to learn homeopathy. And that's how I found out about this course. But I was so happy to be here. But I had a lot of growing up to do. I came from this protected environment, and then all of a sudden I was on my own. So I had a lot of growing up to do. I really, honestly, I didn't even have to go to a bank and deposit a check. I really had a lot of learning to do. And I was raised, you know, that everybody was taught that everybody's nice, you be kind to everyone. And that way, I never had any boundaries and got into a lot of trouble, you know, which at that time, I felt like I was angry. I'm like, why is this person taking advantage of me? But I never had any boundaries. I just thought everyone was nice. But the stress of growing up really caused a lot of stress on my body and caused Hashimoto's for me. So I relate to them who talk about the stress in their relationships. And, you know, in my chapter 6 of my book, I talk about emotional healing. I talk about energy vampires, the relation between a narcissist and an empath. So just wanted to mention that. So back in, I think this was in 2006, I was like in my last year of medical school here, and I was doing a shift with Dr. Gino Tutera, OBGYN, and you know, I decided to test because I was sure that something is off. And I ran like my complete blood panel, and my antibodies for the thyroid were off the charts. So initially I couldn't even believe. I'm like, no, this is not my blood work. But then everything started to make sense because of the way I was feeling. I had to accept I had Hashimoto's thyroiditis. So just briefly, I want to explain what Hashimoto's is. Our immune system basically begins to attack our thyroid gland, cause inflammation on your thyroid gland and suppresses its activity. So if we do not help that, then over time, this gland is going to get completely chewed up by these antibodies. And there's this concept of molecular mimicry, and this is how Hashimoto's happens. So these are pictures with my patients at the clinic, you know, after my book launch. And this was last year when I was traveling with my book. I had made a trip to India. The picture on the left was in Mumbai, and the picture on the right was at a bookstore in Greece. Actually, this time last year I was in Greece, and this time none of us can travel. So anyhow, we'll all get through this. This too shall pass. So I've been a speaker at some of health summits. This one was about overcoming Hashimoto's. And these words of Mother Teresa really resonate with me. I alone cannot change the world, but I can cast a stone across the waters to create many ripples. So how I look at this is, I want to help a woman each one at a time, you know. So coming back to the symptoms of hypothyroidism. So I know we saw a slide before with the, you know, symptoms, but this one has some other symptoms on it, like loss of, you know, your eyebrows, especially the outer third of the eyebrows. If you're losing your eyebrows, that could be one of the symptoms that you may have a low thyroid condition. The thyroid gland begins to enlarge because it's trying to produce more thyroid hormone. So when, you know, patients have goiter and have difficulty swallowing, that is one of the things. And it's not always possible to till it's like pretty enlarged, we can, you know, feel it. But nodules on the thyroid, you know, and the enlargement can definitely be detected by a thyroid ultrasound. And as I was mentioning, when thyroid is slow, everything is slow. So the heartbeat is slower. You know, patient is usually very tired. And that puts one to the risk for congestive heart failure because the heart is not pumping right. And that's why it's so important also to optimize your thyroid. One can have a poor appetite. A lot of times patients come to me and tell me, I don't eat anything. I hardly eat anything and I can't lose a pound. I hear that. I have been there. And infertility and heavy menstruation. So they could go months without having a cycle and then all of a sudden have heavy cycle with clotting and blood and all of that. Carpal tunnel syndrome, not exactly, you know, always associated with hypothyroidism, but can be. And cold hands and feet, you know, because of lack of good blood circulation. So people who have freezing hands, feeling cold all the time, can have a thyroid disorder. Constipation, because things are not moving. Everything is slowed down. So even your bowel is slowed down, your peristalsis is slowed down. And one is more prone to constipation when they have low thyroid. Dry skin, puffy face, and thinning hair. So, have you been told when you go to your doctor that this is all in your head? Now, I don't mean to say, you know, like all of you may be told that, but a lot of times I see that my patients have been told everything is fine, all your hormones are fine, and, you know, feeling all this. And a lot of times then they are offered a mood disorder medication, which has a role to play, you know, when it does. But a lot of times I've had my patients come off of 1, but 1 to 3 mood disorder medications. So I'm an integrative practitioner. I believe all kinds of medicine have a role to play, but the hormones also have a huge role to play. And that's what I'm trying to mean here. So why are a lot of patients even said that? Because only one test is done, which is the TSH, or thyroid stimulating hormone. Patients are tested for their TSH. TSH has a wide range from 0.4 to like 4.5. And ideally, you should be closer to the lower end, closer to the digit 1 or lower. As you go high, you know, closer to 3, 4, that means that your thyroid is kind of struggling hard to produce thyroid hormones. So if you know, test anywhere in this TSH, even 4.25, you're told your thyroid is fine, but by then you may be having all the symptoms that I just mentioned. So this is not enough. That is what I mean to say. And a lot of times when patients come, they'll also say that my primary care doctor ran a thyroid panel and everything was fine. Typically, the only test that was run was TSH. So this is the pathway. So the thyroid gland, Actually, this is not the pathway. We'll come to that slide, but I want to tell you how it's made. Tyrosine is an amino acid, and then we need iodine. It gets iodination, and then 4 thyroid molecules come together to make the T4 hormone that the thyroid gland produces. And then your body converts to the active form, which is the T3 hormone. That is the one that's utilized by your cells and produces energy. So remember that T3 is your active thyroid hormone. That should always be checked. And we'll talk more about the optimal levels as I show you. So this is one of the, slides that show you different factors that affect your thyroid function. So it talks about the nutrients, it talks about, the stress, your low-calorie diet, inflammation in the gut specifically, infections, if you have infections, if you have heavy metals, if you have environmental toxification, things like that. All of this affects your thyroid gland. So this one shows that the thyroid gland produces the T4, then it's converted to T3, which is the active hormone, and that is the one that your cells utilizes. The mitochondria produces energy. But sometimes a lot of people convert that T4 to reverse T3. That is not where we want to go. We want to go towards the T3. So on the left side, you'll see all the things that may convert it to the reverse T3, but we want to optimize it and convert it to the T3 levels. So we are going to talk more about the nutrients, food, and the diet, more of the testing in our upcoming talks on the weekends. So today, let's talk about the complete thyroid panel. I told you the TSH, which is the thyroid stimulating hormone that's made by your pituitary gland. Your pituitary gland is the master gland in the body. It's like a pea-sized gland that sits at the base of your brain, and it sends signals to different glands. It sends signals to the thyroid to produce the T4. So when I'm checking for blood work, I want to check for total and the free levels. The total T4 is the one that is bound to the protein. And the free T4 is the freely circulating in the blood. So that's the difference. Similarly, for the total T3 and the free T3. To diagnose and find out if one has Hashimoto's thyroiditis, there are 2 other tests that are extremely important. One is the microsomal TPO antibodies, and the other one is the anti-thyroglobulin antibodies. So make sure, when you see a doctor, and if you have these symptoms, a complete thyroid panel, these tests should be included. So then, when the results come back, so this is showing you an example of the TSH, free T4, and free T3. As I was telling you, your TSH should be at the lower end because the range is huge. The lab provides a huge range from 0.5 to 4.5. Now, if you fall somewhere like here, then you may be struggling with a lot of symptoms. And maybe not, everyone's different, but I'm just generally saying that I see what I see in the office. And then you want to fall at the optimal range. And the yellow part is where you should be to feel great overall. So a lot of times when patients come in who are even on the thyroid medications, if you fall just in the normal range and if you're still having symptoms, you want to talk to your doctor because you want to get to the optimal range. Free T4, the range is again shown, and optimally you should be at least more than 1.1. Here it does show 1.3 to 2.8, but you want to be on the higher side on the free T4, and the free T3 similarly, you want to be on the higher side. 3.5 is a great number to be at, and higher than that is great. You don't want to be more than this because then we don't want to like hyper stimulate you because that would negatively affect you. So for example, we talked about all these symptoms of low thyroid function and hypothyroidism, how everything slows down. But if you are getting or producing too much thyroid, that's hyperthyroidism, and you would have the opposite symptoms, where your heart is racing, beating very quickly, and maybe you're losing weight, you're losing hair. Losing hair can happen if you're low or you're high. You have to be in the good optimal range for your hair to stay healthy if it is related to your thyroid. So that's optimal versus thyroid levels, normal levels, I mean. And then what is the root cause? So I showed you that picture, which showed the different things that affect the thyroid. And we are going to get into the root cause and the functional testing to find the root cause for my patients and what the results of these functional testing look like and what we can do about it in the following subsequent weekly Zoom meetings. Okay, so now what I want to do is I want to show you actually when I order a report and how it looks like. So of course I've removed the patient information for privacy and all of that, but these are just recent reports. Actually I just picked something from the last couple weeks. So TSH, thyroid stimulating hormone, remember this is not the only one. Remember, you want to have a complete thyroid panel. So here I've ordered a complete thyroid panel, which is the TSH, the T3, the T4, free T3, and then, I'm sorry, this is a basic thyroid panel. The next one would be a complete thyroid panel. The basic thyroid panel I would order because I've tested the patient before and they would have had negative thyroid antibodies. So then I don't need to keep adding those because that would add the cost for them. So in this case, you see the T4 is low. The T3 total, even though it doesn't show low, if you see the range between 80 to 200, this patient is at 89. So, that's very low. They want to be in a good range, more like 120 and above. TSH is suppressed here because this patient is on the thyroid medication. So imagine if this patient only had a TSH test done and didn't have all the other testing done. If I looked at the report, I would say, okay, maybe everything is fine. I typically don't do that because I'm always used to seeing all the other numbers, but a lot of times optimal thyroid treatments don't happen because only the TSH is ordered. So the free T4 hormone is low. The free T3 is at 2.5. Remember I told you 3.5 is more ideal. So this is 2.5. So even though the patient is in normal range, they're still not in optimal range. So of course this patient came in and had most of the symptoms, extremely tired, so just wanted to show you actually what it looks like when the reports. I hope this is helpful to you. This is the another patient. Similarly, the thyroid panel is ordered, and here you'll see the complete panel with the thyroid antibodies. So in this case, the microsomal TPO antibodies and thyroglobulin antibodies are negative. So that tells me, okay, there's no inflammation going on the thyroid, so there's no Hashimoto's, which is a good thing. And then we focus on these numbers here. So here you'll see the TSH is high, which is typically the case when the patient has low thyroid. The TSH is high and the T4 and the T3 are low. So this is a classic example of that. Now here there are other hormones that are tested as well, but again, we're going to talk about the other hormones on the other weeks actually. So we are focusing on the thyroid results today. Okay. So I showed you the blood results, which is like a serum test, like you go to a Sonora Quest, that's where the patient went for blood draw, and the report based on that. But there are different ways. So this one is a thyroid test, which is a blood spot. So these days, my patients have been not wanting to go to the lab sometimes just because of, preventing exposure. And I totally understand that. So there is an at-home kit where you do your finger prick, collect the blood and, dab it on the, little paper as instructed. It comes with the instructions. And then I get this result. So in this case, the thyroid test that this lab provides, it provides the TSH, it provides the free T3, it provides the free T4, and it provides the TPO antibodies. They still do not have the thyroglobulin antibodies in this test, but at least we know that the patient doesn't have Hashimoto's here. Now, there can also be a scenario where the TPO antibodies can be fine, like this is in the green zone, but she could have anti-thyroglobulin antibodies, which don't show up here, but I just showed it to you in the previous one. Now, she's also feeling tired. Her medication was changed a few weeks ago, so we're still optimizing her dose. So free T4 was at 1.1, which again is not bad, but be a bit better would be good. Again, the ranges on blood test, serum-based blood test compared to a finger prick, the ranges, as you see, from lab to lab, they can be different. So if you don't go to Sonora Quest or LabCorp or any of these particular labs, what you want to look for when you're looking at your own report for the free T3 and free T4 is that you should be somewhere in the middle, not towards the lower end, but somewhere in the middle or higher. And for your TSH, what you should look for is that you should be at the lower end rather than the higher end. And then make sure you always check the thyroid antibodies. So this is a question for you. If you want to continue this journey with me, you can go to calendly.com/Dr. Thacker. It's also available through my website, my calendar, and we could do one of the online consults for you. And then to stay further in touch with me, I would love to interact with you. And, you know, I've made this Facebook group called Feel Your Best Self. And there I also share this quote on the top: life is simple and life can be simple again. It's from my book, actually. And I do believe that we just complicate lives. And I think if something COVID taught all of us is basically as humans, you know, food, shelter, basic companionship, you know, that's what we really need. But, you know, anyhow, I would love to be in touch with you, so you can join me and you could join the Facebook group called Feel Your Best Self. I invite you there, and we can even, you know, share things with each other. You can post there. We can ask questions in a group setting. So thank you for listening to me. Really, thank you. Thank you for taking time on a Saturday for listening to me. And I open this up for questions now. Again, I cannot give one-on-one medical advice right now, but I can answer something in a group setting. So if you have a question, you know, feel free to unmute yourselves and ask that. Oops, I'm sorry, I went too far. Okay. Let me do this. Maybe I can stop sharing my screen. And this way I can see all of you. Great to see you, Ellen, and your nice big smile. I cannot hear you. If you want to unmute yourself, or maybe I can unmute you. Let's see.
I just unmuted myself, Dr. Thacker. And
okay, hi.
hi, Jim is listening as well.
Oh, wonderful. That's great. That's wonderful.
Yeah, so I'm just curious, why does the thyroid affect women more than men? Is there a reason for that?
That's a great question. You know, there is no particular reason for the gender, you know, orientation that I know of, you know, and I know that in women, you know, when it's usually diagnosed is typically when maybe after pregnancy or after giving birth, you know, when they are lactating or nursing, when they go through menopause. So as women, we go through these major physiological changes in our body. And a lot of times when women go through these hormonal changes, that's the time the thyroid is also diagnosed. Not always, but that's what I see in practice also. but it's definitely affecting the women, you know, 5 to 8 times more than men, for sure. Anyone else? Any of you have any questions? Thanks, Lisa. Lisa has joined the Facebook group. Sure, you know, right after this, I would go and approve you there. Would love to have you in the group.
I have a question, if you can hear me.
Yes, hi, Linda, I can hear you.
Yes, I just wanted to mention something that you've probably seen, but maybe the others haven't. My mother had thyroid issues, but I also had a diabetic brother who was type 1 diabetic. And when he got older, he developed hyperthyroidism. And the main thing I noticed was that he was eating tremendous amounts because he was in high gear metabolically. And so he was eating 2 and 3 meals when he came to visit me. And I was just appalled. I didn't know what was the matter. And it ended up, I think he had to have his thyroid removed because there was a, you know, malfunction there, obviously.
Yes, yes, thank you, Linda, for sharing. So you are right, you know, people have hyperthyroidism, which causes all the opposite symptoms, and increase in appetite is one of them. Sometimes there's an underlying cause like Graves' disease. And you know that a lot of times what's done is the thyroid is kind of shut down by the radioactive iodine treatment. You know, it's kind of just ablated and then it doesn't function anymore. And then a lot of these patients are then, you know, in the hypothyroid state and then have to be put on a thyroid medication. So that scenario happens a lot as well. But yeah, I can understand, you know, he was eating more and then he already had diabetes, which would have probably, you know, affected it. A lot of times when the patients have hypothyroidism or underactive, I have seen this so much that their lipid levels are always testing higher. So they tell me that they're eating well, they don't have extra fats, saturated fats, and they cannot understand why their cholesterol level stays so high. And a lot of times it's because their thyroid is under functioning, and that's why it's testing high like that, no matter what they do, because the liver is not processing the hormones right, and you know, it just kind of stays there and shows up in the blood work. So a lot of times just by optimizing the thyroid, we see the lipid panel the next time and patients are like, I did not change anything, but everything looks so different. It was just because of correcting the thyroid. So it does play a role for your, you know, overall body.
Yes, I did experience a swing in my own levels, and I was waking up in the middle of the night doing housework, and I was just really getting lots done. But the doctor said, well, it's a little hard on your heart, so we better reduce the dosage of your levothyroxine at that point.
Yeah, yeah. And you know, this thyroiditis can come on like actually somebody I know, you know, in India right now, she actually was hypothyroid and she got this thyroiditis attack and she was put in the hyperthyroid. So suddenly she was losing weight. She lost a considerable weight and she kept eating a lot, but still dropping that weight and, you know, having that heart racing and dizziness. And she couldn't even like, you know, walk a little bit without feeling tired. So yeah, but she's getting better now, which is a good thing. Yes.
Dr. Thacker?
Yes.
Is there a genetic tendency for problems with the thyroid? My father had a goiter, and then of course I've been diagnosed with a thyroid issue, and one of my daughters is going through. They're testing her, but they found that she has some nodules on her thyroid. So.
Absolutely, Ellen. Yes. So more than genetic, I would say family history plays a huge role, you know. So if the mom has, you know, Hashimoto's or hypothyroidism, a lot of times the daughters would have, or the siblings, would have. And you said your father had that, So, and the thyroid nodules are extremely common, with Hashimoto's. So a lot of times, and they are diagnosed by a thyroid ultrasound. So if they are a small size, they kind of leave it alone and watch it like from year to year to see if they're growing or not. And, if they are a bigger size and if they are affecting something or, causing difficulty swallowing or something like that, then sometimes they have to be removed. But usually by, correcting the thyroid by even using these natural steps, a lot of times it can be under control, So just wanted to share that. And even going back to the hyperthyroid that we were talking about, I have successfully helped patients, with using natural botanical medicine to slow down the thyroid, because when the patient is having hyperthyroidism, which is much less common than hypo, hyper is much less common than hypo. Usually when the thyroid is overproducing, patient is prescribed like a beta blocker and an anti-thyroid medication, basically. So it, basically slows down their heart rate, but a beta blocker would do that. That's one of the medications for increased blood pressure, and like an anti-thyroid medication. So typically I've seen that these kind of patients are put into then a hypothyroid state. So sorry if I'm giving too much information and saying a lot about it, but I see that, and I just feel that a lot of things can be done naturally before a major thing needs to be done, by removing a part of the gland or removing the nodule, or, having to shut down the thyroid by radioactive iodine. There can be natural things that can be done before that. So, yeah. Great. Anyone else have any question, ladies and gentlemen? Well, wonderful. If no one has any questions, that's fine too. If you have questions or, want to schedule a consult with me, then we will definitely do that. Lisa is asking what natural things. So Lisa, since this is going to be like a ongoing, series or talks, I'm going to definitely talk about the naturopathic treatments next week. So, you can feel free to join again next week, and I'll share the time and everything via email and social media. So meanwhile, if you want to read my book, it's 7 Steps to Heal Your Thyroid. It's available on Amazon as well. You can order like a soft copy or soft cover version, or you can even do a Kindle version. So you can read about that. I've talked about the natural things. I've talked about thyroid healing foods and other great information that you may have. So with that said, thank you everyone for joining. I wish you a great rest of your Saturday and weekend, and I hope to see you next week if you have more questions or are interested in learning more. And if you want to share the information, that I'm doing these talks weekly with any of your friends or family who may be interesting, feel free to share that with them too. I'm here to help. Thank you. Bye-bye.
Bye-bye.